If you're over 60 and still masturbating the same way you did in your 30s, you could be causing serious damage to your circulation, your prostate, and your nerve function. As a urologist with 25 years of experience, I've seen the consequences of men who never learned to adapt their technique to their aging body. Today, I'm going to explain exactly how to masturbate safely after 60, the 3 critical mistakes that could be harming you right now, and the warning signs that mean you need medical help immediately. I'm Dr. Mei Anderson, a board-certified urologist and men's health specialist. Over the past 25 years, I've treated thousands of men dealing with the complications that come from not understanding how masturbation needs to change as we age. This isn't a topic most doctors discuss openly, but it should be, because masturbation after 60 can either support your health or seriously damage it. And the difference comes down to technique, frequency, and knowing when something's wrong. Let me start with the medical facts. Masturbation doesn't become unhealthy after 60. In fact, regular, gentle self-stimulation supports prostate health, maintains circulation, and helps preserve sexual function. But your approach must change because your body has changed. After 60, several critical systems that affect sexual response undergo significant shifts. Your testosterone levels decline by about 1 to 2% per year after age 30, but this decline accelerates after 60. The blood vessels that supply your penis become less elastic due to changes in collagen and elastin, making erections slower to develop and harder to maintain. Your nerve endings become less sensitive, what neurologists call age-related sensory decline. The nerve conduction velocity slows down, meaning signals take longer to travel from your penis to your brain and back. Most importantly, your recovery time increases dramatically. Your refractory period, the time needed between ejaculations, can extend from minutes in your 20s to days in your 60s and beyond. Here's what most men don't realize. When you don't adapt your masturbation technique to these changes, you can cause lasting damage that affects both solo and partnered sexual experiences. I'm going to walk you through the 3 most dangerous mistakes I see men over 60 make when masturbating. Mistakes that can lead to nerve damage, prostate inflammation, and circulation problems. Then I'll give you my step-by-step protocol for safe masturbation after 60, including specific positioning recommendations and product suggestions. Finally, I'll cover the specific warning signs that require immediate medical attention, and how to have that potentially awkward conversation with your doctor. This information could prevent you from developing conditions that are difficult and sometimes impossible to reverse. The first and most damaging mistake is using excessive pressure and grip strength. When men notice decreased sensitivity as they age, the instinct is to grip harder and apply more pressure. This is exactly the wrong approach and can cause permanent damage. From a urological perspective, the penis contains delicate erectile tissue called the corpus cavernosum, spongy chambers that fill with blood during arousal. This tissue is surrounded by sensitive nerve pathways and tiny blood vessels called capillaries. When you apply excessive pressure during masturbation, you compress these structures and can cause lasting damage. Over time, this compression can cause what we call pressure-induced neuropathy, essentially nerve damage from repeated trauma. I've treated men who developed permanent numbness in areas of their penis because they consistently used too much pressure during masturbation over years or decades. Excessive grip can also damage the small blood vessels that supply the penis, leading to reduced circulation and difficulty achieving erections even during partnered sex. This creates a vicious cycle where decreased sensitivity leads to more pressure, which causes more damage and even less sensitivity. I've had patients tell me they can only reach orgasm with an extremely tight grip. So tight it would be painful with a partner. This is a clear sign of nerve damage from years of excessive pressure. The medical solution is what I call pressure titration. Start with the lightest touch that produces any sensation at all. If you can't feel light pressure, the issue isn't that you need more force, it's that your nervous system needs more time to respond. Allow 60 to 90 seconds for nerve pathways to activate before gradually increasing pressure. Never grip so tightly that you're compressing the shaft completely. Think of it as gentle massage, not mechanical manipulation. If you're finding this helpful so far, make sure you subscribe to Vital Health Seniors. My next video will reveal the 3 biggest erection killers that have nothing to do with testosterone, and you don't want to miss it. Now let's talk about the second critical mistake I see men over 60 making. The second critical mistake is masturbating too frequently for your age-related recovery capacity. Many men continue daily, or even multiple daily masturbation patterns from their younger years, not understanding the physiological changes that make this harmful after 60. Here's the urological science. Your prostate produces about 30% of your seminal fluid, including important enzymes and proteins. After 60, your prostate needs significantly more time to replenish these secretions. When you masturbate too frequently, you're essentially forcing your prostate to work overtime, which can lead to inflammation, discomfort, and potentially contribute to benign prostate enlargement. Additionally, your hormone cycles change dramatically after 60. Frequent ejaculation can disrupt your natural testosterone rhythms, leading to fatigue, mood changes, and decreased libido over time. Your luteinizing hormone and follicle-stimulating hormone levels also become more sensitive to disruption. I've seen men who masturbate daily after 60 develop what I call ejaculatory fatigue syndrome, where each subsequent orgasm becomes less satisfying, takes longer to achieve, and leaves them feeling drained rather than satisfied. From my clinical experience, the optimal frequency for most men over 60 is every 48 to 72 hours. This allows your prostate time to recover, your hormone levels to normalize, and your nervous system to reset. Some men find that spacing it out even more, say twice per week, provides the most satisfying experiences. I've had patients who reduced their masturbation frequency and found their experiences became significantly more pleasurable and satisfying. They reported stronger orgasms, better energy levels, and improved mood. Quality over quantity becomes increasingly important as we age. The third mistake is attempting masturbation without proper lubrication. Many men think lubrication is only necessary for vaginal intercourse, but this is medically incorrect, especially after 60. As testosterone levels decline, your body produces less natural lubrication during arousal. The pre-ejaculatory fluid that once provided some natural lubrication becomes scanty, or may disappear entirely. Simultaneously, the skin of the penis becomes thinner and more susceptible to microtrauma. Dry masturbation creates friction that can cause microscopic tears in the skin. Tears so small you can't see them but large enough for bacteria to enter. These microtears serve as entry points for bacteria, potentially leading to infections, inflammation, or conditions like balanitis, inflammation of the head of the penis. I've treated numerous men over 60 who developed recurrent infections because they never used lubrication during masturbation. Some developed chronic inflammation that made any sexual activity painful. Even more concerning, repeated dry friction can lead to scarring of the penile skin, which reduces sensitivity permanently. I've seen men who developed what's essentially scar tissue around the head of the penis from years of dry masturbation. From a urological standpoint, the solution is straightforward. Always use a high-quality, unscented, water-based lubricant before beginning any self-stimulation. Apply it early in the process, not as an afterthought when friction becomes uncomfortable. Avoid products with glycols, parabens, or artificial fragrances, as these can cause irritation in sensitive, aging skin. Also avoid oil-based lubricants if you use condoms with partners, as oil can break down latex. Some specific products I recommend to my patients include brands like Good Clean Love, Aloe Cadabra, or simple drugstore options like KY Naturals. The small investment in proper lubrication can prevent significant medical problems down the road. Now let me give you my complete protocol for safe masturbation after 60, what I call the CARE method, with specific positioning and technique recommendations. C stands for cleanliness and comfort. Always wash your hands thoroughly before beginning. Ensure your environment is clean, private, and comfortable. This isn't just about hygiene. It signals to your nervous system that it's safe to relax. Consider your position carefully. Avoid sitting on hard surfaces that can compress nerves. A reclining position or lying on your side often works best. A stands for appropriate technique. Apply lubricant first, This is non-negotiable after 60. Start with light pressure and slow movements. Use your entire hand, not just fingers, to distribute pressure evenly. Allow your arousal to build gradually rather than forcing it. If your grip tightens unconsciously, pause and reset. Consider alternating hands or changing your grip position every few minutes to avoid repetitive strain on any one area. Some men find that using a sleeve or texture device designed for men can provide stimulation without requiring a tight grip. R stands for respect timing and recovery. Allow 15 to 20 minutes minimum for the full experience. Don't rush toward orgasm. Let arousal build naturally, fade, and return. This wave-like pattern is normal and often more satisfying than a direct approach. Follow the 48 to 72 hour recovery rule between sessions. E stands for evaluate constantly. Pay attention to your body's signals during and after masturbation. Any unusual pain, changes in sensation, or unexpected responses deserve medical attention. Speaking of medical attention, here are the specific warning signs that require immediate evaluation by a urologist. First, any pain during or after masturbation that lasts more than 30 minutes, especially if it's sharp, burning, or worsening over time. Second, sudden changes in sensation, new numbness, burning, or tingling that doesn't resolve within a few hours. This could indicate nerve compression or damage. Third, visible changes, swelling, discoloration, unusual bumps, or any discharge that persists beyond 24 hours. Pay particular attention to any discharge that's yellow, green, or has an unusual odor. Fourth, urinary symptoms, difficulty starting or stopping urination, changes in flow strength, pain during urination, or increased frequency that coincides with masturbation. Fifth, any bleeding no matter how minor it seems. This could indicate skin tears, irritation, or more serious underlying conditions. And sixth, persistent changes in erectile function. If you notice that you can no longer achieve erections during masturbation when you previously could, this may indicate circulation problems that need evaluation. Don't hesitate to contact a urologist about these concerns. We've seen it all, and early intervention prevents minor issues from becoming major problems. Masturbation after 60 can be a healthy part of your self-care routine when done correctly. It supports prostate health, maintains circulation, reduces stress, and helps preserve sexual function. But it requires adapting your technique to match your body's changing needs. Remember the key principles: slower, gentler, less frequent, and always with proper lubrication. Your body has earned your respect and care. This isn't about performance or proving anything. It's about maintaining your health and staying connected to your body in a positive way. If this urological guidance was helpful, subscribe to Vital Health Seniors for more evidence-based men's health information. And please, don't suffer in silence if you're experiencing any concerning symptoms. Your sexual health is an important part of your overall health, and addressing issues early prevents more serious problems later. Take care of yourself. You deserve to age with confidence, comfort, and dignity.